Good morning. My name is Mark Perry, and I am a distance student from Nova Scotia. The title of my speech is A Blow to the Head. How many of you have ever been to a hockey game? If you have, chances are you've seen a player be injured and fall to the ice. Maybe they were carried out of the arena. The player is injured severely enough they could miss several games, weeks, or even months. Sometimes it's attributed to a concussion. I'd like to speak to you today about the dizzying world of post-concussion syndrome. On August 18, 2009, I was involved in a serious workplace accident. I was struck in the face and head by a large piece of wood spinning at a high rate of speed. The impact to my face caused several damages: a broken right orbital socket, 3 breaks to the right cheekbone, damaged jaw and sinuses, and a severe concussion. I would like to explain to you today what post-concussion syndrome is, what the symptoms are, and what recovery presents. The first question you may ask is, what exactly is post-concussion syndrome? It's the illness which combines a number of serious post-concussion symptoms such as nausea, headache, fatigue, dizziness, anxiety, possible depression, irritability, sensitivity to light and noise, loss of concentration. Post-concussion syndrome is a direct result of a concussion being a mild traumatic brain injury, and in most cases a closed head injury or no penetration of the skull. If we think of this helmet as a skull, the nice hard outer surrounding, the brain itself is inside, surrounded by a layer of liquid as protection. The skull protects it from minor bumps and abrasions. In the case of a concussion, the skull strikes an object, causing the brain to bounce off the inside of the skull, or has an object strike the skull hard enough to cause the same damage, the brain striking against the inside of the skull, resulting in a concussion. Sometimes, but not always, the person loses consciousness during the concussion. In the case of post-concussion sufferers, the loss of consciousness is generally less than 20 minutes. After the initial injury, a person may develop a series of ailments associated with post-concussion syndrome. Some, but not all of them, certainly include headaches, fatigue, and nausea. To determine whether or not a person has post-concussion syndrome, a doctor will perform a series of tests. Certainly an X-ray to look at the initial damage to the skull, a CT scan which can look more in depth at the brain and any traumas it may have suffered, and certainly some form of psychological testing. The latter of these tests is used to determine the degree of impairment to the brain. They look for things such as short-term memory loss, executive function or behavior, attention, motor skills, and cognitive, the applying and processing of information. Once a diagnosis has been made, it becomes important to identify the specific symptoms of post-concussion syndrome that a person suffers from. Post-concussion syndrome has a wide variety of symptoms that can cause recovery to be frustrating and difficult. These symptoms can be divided into 3 main categories. They are the cognitive, the physical, and the affective symptoms. The first of these, cognitive, again, is the thought process of the brain. Some of the symptoms doctors may look for are impaired memory or loss of memory, poor concentration or ability to focus, and attention deficits. All of these symptoms can be very frustrating for an otherwise normal person who has never experienced these problems to suddenly be faced with. The blow to the head itself can cause damage to the physical well-being of an individual. Some of the symptoms are headaches, which are compared to migraine or tension type, vertigo, dizziness, nausea, fatigue, loss of smell, and sensitivity to light and noise. Dr. David King, a noted Halifax neurologist, stated that often these symptoms are aggravated and made more severe when an individual pushes their current limitations. In my case, that seemed to be physical activity for a mere 10 to 15 minutes. Once I had pushed those boundaries, there was no undoing the symptoms. The last of these symptoms is the affective. This is the change in the emotional state of a person. Symptoms in this case may be irritability, anxiety, and even depression. Sometimes, in rare cases, family members, or partners notice a complete change in a person's personality post-injury. All of these symptoms are difficult to process. Knowing one's own limitations and coping with the fact that only time can heal. The last area I will discuss with you is, what does recovery present? Again, once post-concussion syndrome is diagnosed, the individual symptoms are identified, the focus will be on recovery. Doctors can offer several options, such as medications or exercise and treatments, to help a post-concussion sufferer hopefully transition back to full health. Medications may be prescribed by a doctor to help ease specific symptoms and aid in the comfort of the individual. The Mayo Clinic stated that most post-concussion sufferers suffer from severe headaches compared to migraine, and at times tension type, sometimes attributed to a neck injury at the time of the initial concussion. The medications are used not only to treat the headaches, but in combination to help reduce nausea, fatigue, vertigo, dizziness, and insomnia. Dr. David King stated, "The medications are used to treat the specific symptoms and give the body some leeway to start its own healing process, to help an individual get over that initial unpleasant hump." Doctors, aside from medications, may prescribe exercise, actual physical exercise, to help an individual recover as well. Minor activities such as short walks or light housework get the body moving and give the individual something else to focus on. Mental exercises such as crossword puzzles or Sudokus are used to help keep the mind fresh and active. Occupational therapist Cheryl Lake with the King's Physio Clinic said that an individual who is at home resting due to an injury, their mind is much different than that of someone working or on a normal day-to-day basis. It is important to the emotional and mental state of that person to keep the brain stimulated. The Mayo Clinic has stated that individuals who suffer from post-concussion symptoms show those symptoms within the first 7 to 10 days post-injury. Generally, the symptoms dissipate after 3 months, but can last a year or longer. I'm dealing with symptoms some 10 months later. It is very frustrating, but I'm optimistic as each day gets a little better. Again, post-concussion syndrome is the illness associated with concussions. The symptoms widely range from headaches, fatigue, dizziness, nausea, memory problems, change in mood or personality. Doctors can prescribe medications to help ease the symptoms, as well as recommend exercises to help the individual recover. The bottom line is, it all takes time. Each case is individual and depends on the severity of the injury. All this from a simple blow to the head. Thank you.